Hello, everyone. Today we're going to talk about vestibular disease. Okay? Before we can understand the vestibular system, we first need to know where it is located and go through a bit of anatomy first. This is our ear. Why do we talk about the ear? Because vestibular disease is located behind the ear. Here is our ear, and below this is the eardrum, right? Can you see this ear canal? Next to that ear canal is this bone area, which is the middle ear, and we can see a snail-shaped structure. This snail shape is the cochlea. This part is for hearing. This bone transmits sound, and this ear part receives sound. That's why there are some headphones that don't go directly into the ear canal, but are worn around the ear, around the bone area, so that sound is transmitted in. So where is the vestibular system? The vestibular system is this twisted structure here. It is located next to the cochlea, deep inside the ear. Essentially, the vestibular system is like a sensor in our car. Just like sensors around a car, the vestibular system is no different from a vehicle sensor. These sensors must be accurate so the car can navigate well, maintain distance, and keep balance properly, right? Similarly, the vestibular system must function properly so that our brain knows whether we are standing, lying down, or tilting, whether we are moving or staying still. The key point here is that this sensor cannot control itself. It needs a processing and adjustment system. And where is that processing and adjustment system? It is in the cerebellum and brainstem, not in the vestibular system itself. The vestibular system is basically just a sensor. It cannot make decisions on its own. So vestibular disease has two main causes. First is a local cause, meaning the sensor area itself, the vestibular system, is malfunctioning. Why does the sensor malfunction? It could be due to inflammation or ear stones, calcium deposits. This type is usually acute, and it causes very strong symptoms like severe spinning sensations, nausea, and dizziness. Even slight changes in posture can cause a spinning feeling in the head. There may also be tinnitus, ringing in the ears, and reduced hearing. For this group, it is recommended to go to medical facilities for early examination and treatment. This is the first group. The first cause is acute, due to malfunction in the sensor area. This type is relatively less common. But the second type is more common, chronic. Chronic means it is not mainly caused by the vestibular area itself, but by the control system. As mentioned earlier, the vestibular system is just a sensor, but the system that controls this sensor is the cerebellum and brainstem. The problem is that although it is not intensely painful, it significantly affects quality of life, costing a lot of money, effort, and time for treatment, while many people still do not understand the root cause. It causes feelings of lightheadedness, unsteadiness, imbalance, loss of confidence, and fatigue. Many people say this is a lifelong chronic disease that can never be cured. But you must remember, the vestibular system, like any system in the body, needs two things to function: blood supply and nerves to transmit signals. So where does the blood supply come from? Let's look at it. The blood supply to the vestibular system comes from the cervical spine. It comes from the vertebral artery in the neck, which goes up and supplies the cerebellum and the vestibular system. Therefore, if the cervical spine loses its natural curvature, blood flow will decrease. We can see that this blood vessel travels in a zigzag path, making it very easy to become narrowed, especially when we bend our neck too much, use the wrong pillow, twist and strain, or distort the natural cervical curve. It becomes narrowed at these bends. If you take an X-ray, most people with vestibular problems have abnormal cervical curvature, either completely straight, deformed, or having disc herniation or bulging that compresses the area. When blood supply is reduced, what symptoms appear? Common symptoms include ringing in the ears and dizziness. However, it does not appear severe at first. It develops gradually. The dizziness is often more of a lightheaded or floating sensation rather than intense spinning. Secondly, there may be occasional mild dizziness when suddenly looking up after bending down, standing up quickly after sitting, turning the head or body quickly. You may feel unsteady when walking, especially when tired or sleep-deprived. There's often heaviness in the back of the head and neck, tension in the shoulders and neck, frequent mild tinnitus, a buzzing sound, slight blurred vision when changing posture, and sometimes seeing floating spots like fireflies. Sleep disorders are also common, such as poor sleep and frequent waking during the night. All of this is due to reduced blood flow through the cervical spine area. Therefore, do not rush to take medication immediately. Restore the natural cervical curvature, drink enough water, stop bending your neck to look at the phone, and use the correct pillow. Regularly do neck muscle exercises to restore the cervical curve to normal. If symptoms improve, then you understand the cause, right? Don't turn simple issues into complicated ones. That is the first part about blood circulation. Now what about the nerves? The vestibular nerve, the vestibular system here, and the cochlea both merge into one nerve pathway called the 8th cranial nerve. This nerve carries signals to the brainstem, then connects to the cerebellum, as well as to the eye control system, and down to the spinal cord to regulate posture. That is why when someone has vestibular disease, they often also experience eye-related symptoms, such as blurred vision or dizziness affecting the eyes. So, if the cervical spine loses its natural curve or has disc herniation due to prolonged poor posture, frequent neck cracking, or incorrect sleeping positions, it will disrupt this nerve signal pathway. The signal becomes unstable, intermittent, like weak electrical signals in remote areas. This leads to dizziness and imbalance. It is that simple. Many people wonder whether to take circulation-boosting medicine, blood flow enhancers, massage therapy, acupuncture, acupressure, electrotherapy, etc. Does it help? It definitely can help, because it speeds up circulation and reduces pain perception by affecting nerve signals. However, imagine a road with a damaged section causing traffic jams. Instead of repairing the road, we just increase vehicle speed. Can it still pass? Yes, but if the blood vessels are weak, especially in people with high blood pressure, diabetes, or high cholesterol, the vessel walls are fragile and stiff. If blood flows too fast, it may rupture, especially during posture changes or at night. In summary, it helps circulation, but the root cause must be addressed. Reopen and restore proper pathways. Improve cervical curvature, do neck exercises, drink enough water, practice deep breathing, and ensure adequate nutrition, especially nutrients related to the nervous system such as calcium, magnesium, B vitamins, and carbohydrates. So everyone has now understood the mechanism and causes of vestibular disease, right? In summary, if it is acute, go to a medical facility. If it is chronic and severe dizziness occurs, you may use circulation supporting methods or massage therapy temporarily. But the root solution is restoring cervical curvature, opening proper pathways, and ensuring adequate nutrition. Wishing everyone good takeaways from this knowledge. If you find it helpful, please give a like or share, everyone.